This is ABC 7 News at 6.
There's a new technology that claims to tackle a cosmetic problem that diet and exercise can't solve. It's cellulite, the wavy bumps of fat just beneath the skin.
Here you are before, and you can see the fullness in this area, depressions.
Lizette Valencia is looking at a 3D image of her own thighs several months ago, and in her mind, the pictures aren't pretty.
And I do have cellulite. It didn't matter what I wore. You could see the ripples on the side.
But today, San Francisco plastic surgeon Michael Kulick is going to attempt to smooth some of those bumps, not with surgery or liposuction, but an emerging laser technology. He says it works by distributing heat to different layers of a patient's skin tissue.
There are actually two wavelengths. The first wavelength softens the fat, and the second wavelength opens the pores to allow the fat to leak out and to be absorbed by the lymphatic systems.
Once Dr. Kulick begins moving the laser across Lizette's thighs, it will raise the temperature of her skin by about 5 degrees. As the fat cells are liquefied, a vacuum and roller system built into the housing manipulates the tissue. The company says that helps the dead fat cells move into the lymphatic system. The process can produce some discomfort.
It was just a little bit painful at the beginning, like the first couple of minutes.
While the bumps may look like large mounds of cottage cheese to Lizette, documenting improvement from the treatments is a matter of microscopic measurement. Dr. Kulick documented results from 20 patients, scanning the treated areas using a three-dimensional camera system to compare the minute contours. In a paper published in the Journal of Plastic and Reconstructive Surgery, he reported that 3/4 of those patients showed measurable improvement lasting over a 6-month period. But he cautions the device, known as Smooth Shapes, does not produce the slimming reductions of liposuction.
It's not an inches device, it's a cellulite smoothing device. So unlike liposuction, it's really not designed to improve contour in terms of volume. Having said that, patients had changes up to a centimeter or a centimeter and a half in the area of treatment.
Lizette says her husband noticed the change after just a few sessions.
The first thing he said was smooth. He said he felt smooth. He didn't feel like a rippling effect on the side of the leg or anything like that.
You can see that this area is much smoother. What do you think?
It's great. I totally tell.
Now, the treatment involves 8 sessions stretched out over 2 months. Dr. Kulick says the cost ranges from $200 to $1,200, depending on the size of the area being treated.
Interesting.